Hello everyone. Today I'll begin my lecture with social services. In my previous lectures, I had been extensively talking about social policy, welfare aspects, welfare state, welfare services, and today, very briefly, I'm going to talk about social services also because these are all connected and interrelated. Although there might be a thin line in describing or in defining welfare services and social services. Welfare services are more particularly related to the idea or to the state responsibilities. Social services where both parties, governmental organizations, non-governmental organizations, institutions, voluntary institutions, it can encompasses a wide range of services which can be given to individuals, communities, groups. And again, like the welfare services, social services too includes health, education, environment, ecological balance, laws, digitalization, reforms, every aspect. When there is any kind of a reform or change in the society, social services would come into existence. So if you look into the definition or understanding of social services, what it could be understood at improving the well-being of individuals and communities. It ensures the support of for various life challenges and social needs, and it provides certain kind of assistance protection measures to promote social inclusion and equity. And at the same time, if you talk about the services, it covers a wide range of services which had been discussing in my previous lectures also, like healthcare, education, a support system to the vulnerable population, financial security, financial stability, social insurances, social assistance program, so forth and so forth. Social services, they are part of government services which focuses on providing basic communities assistance support to the most vulnerable or specific groups, primarily those who come in the lower socioeconomic status, or those who are extremely poor. So it can be considered, social services from the point of competence. Social services can be considered as a part or as an element of the welfare system, which consists of the spectrum of financial, organizational, and legal tools and measures, and which has the primary interest which of it rests on compensation of interaction of financials, social consequences, trying to understand the social consequences, looking into the socioeconomic upheavals in the society, and also looking into the possible solutions to tackle these issues, whatever resulting the crisis which may be present in a society, creating unfavorable situations for the existence of mankind, and in which where a family, an individual, or a community faces challenges and potential risk from the day-to-day activities. So social services, they are used to address a society's wide range of requirements. And prior to this industrial revolution, social services were largely limited to private entities and charities, and their coverage was likewise limited. But today, of if we talk about today's and modern era, social services are now widely viewed as an essential function of the society, and it is a means, a provision which is being provided by the government to solve social issues, societal concerns, which poses a challenge, which poses a threat to the mankind on a global scale. Government's provision of social services, is based on universal human rights, liberal principles, and also the religious and cultural rights. If you look into the forms of social services, or they are usually been described, it is in this forms of social service, I would give a conceptual, or rather would give clarity. There are three aspects to it, ambulatory form, residential form, and outreach form. When you talk about ambulatory form of social services, this form of social services is provided via certain facilities, while at the same time it is also aimed at individuals that attend or are transported or are escorted to the place where welfare services or social services are being provided, like facilities for elderly, institutional care for the elderly, facilities for the children. Foster care is there. Then there are orphanages, or there are certain institutional care for the vulnerable population, or those who are under homeless, or any such vulnerable population. So it is provided through certain institutional or facilities where it looks after the welfare of the individual. Then residential form, this form of social service is provided as a year round social service, or as a week long social service, and it concerns the provision of social services that would include the provision of accommodation in the facilities where social services is provided. So residential form particularly talks about a time duration, a time period is there, whereas in the ambulatory the person would be staying in that place for more than a specified it would be a lifelong process. But in residential, the services are provided for a limited period of time, maybe a week long social services, or maybe around the person might have to leave the resident and have to get along with his daily work. And in this respect, when you talk about the residential form, in this respect, the law also covers various vulnerable populations, including the minors, that can use the above form of social services. However, only a written consent would be given by their legal representative, or the carer of an individual who has been designed, who has been designated as a carer to receive that kind of juvenile homes are there in that context. Then there is an outreach form, and this form of social services is provided via activities which are directly in the natural environment where individuals that constitute the target group stay. So this form also provided means of outreach activities or outreach programs, and the prevention of the rise of social exclusion of individuals, families and communities, or the whole community due to adverse social situation becomes a primary task. So these are the three form: ambulatory, residential and outreach form of social services, which may be, depending upon the situation, depending upon the need, and depending upon the target population, it is applicable to certain population. If you talk about the development of uh, uh, social services movement, or the institutionalization of social services, from the historical point of view, it becomes very necessary to look for the connection of social services within social work and outside social work, and the members of the society through activities of various church institutions within which providing of social services had taken place in their non-institutionalized shape. So initially it was more of a charitable approach, it was more of a philanthropic approach, which was in the non-institutionalized manner, addressing to the individuals, groups, or population having low socioeconomic status, sufferings from the health, bad health conditions, poverty and social exclusion. Charitable approach, if you talk about the charitable approach, the beginning of providing of social services is characterized by this approach, and within this approach, and on the basis of one's neighbor, on the basis of the affectionate on the basis of having affection towards one's neighbor, of first almshouse and orphanage took place. So you could say that the origins of welfare services or social services are somewhat similar in nature, because they all were initiated with the poor laws, or with charitable institutions, or with a very philanthropic approach. And when the important role was during this time, the important role was played by the church. That was the 19th century. Then there was this another approach that was considered to be a medical approach, that consisted of formation of institutions, and at the same time interest in providing social services took place within specialization of services, together with the isolation of individual and groups. So in this connection, there had been a formation of various regulations. It was being into creating understanding the nitty-gritties of welfare activities or social work or social services approach. Then there was a normalization approach where it led to the interest in providing a complex of social services in such environment which would recall or which could be which could be compared with the normal environment of other inhabitants. So when providing social services, the capacity of individual facilities of social services are being decreased. The process of development of daily stays was also being supported, and as well as the process of social integration also started. So then there was this civilian approach. So there were certain approaches which had resulted in the formation of or institutionalization of social services, like charitable approach, medical approach, normalization approach, and civilian approach. The attention of the mentioned approach or other civilian approach focused on the providing social service compliant with existing and honoring of the basic human rights, as well as enforcing the opinion on justification of the existence of social place for each individual or person. Within the system of social services, providing these services which would take place, trying to pursue at this time of individual's needs and expectations, or when he is in dire need of any dire need of is resolving his or her issues. So the endeavors for differentiated approach, we were getting the attention, the forefront attention, and the same applied to the the quality and efficiency of social services competence, which would make it its contribution so that it was possible for each and every individual to create a natural part of the community. So at present time, it becomes necessary to focus the attention on further development of social services and how this is happening on the basis of significant changes which in the social environment, through which pressures on the legislative forms as well as support of the further developmental further development area of finance, area of financing and increasing of quality of social services would take place. If you look into the historical development of social services in India, it could be again traced through several key phases, each reflecting changes in the governance, societal needs, as well as economic policy. Starting from the various ancient and medieval periods, social welfare in ancient India was community driven. It was rooted in religious and cultural values. The various religious institutions provided food, shelter, and some alms and aid to the needy people. Even the village community, panchayats, the caste group took care of social services or provided social support within the communities. So charity and service with core values which were supported by the royal patronage. Then the colonial period came into existence, and under the British rule, social services began to take a formal structure, albeit limited and selective. Nevertheless, the British introduced famine relief, public health measures, and education primarily to maintain stability and create a viable or a colonial workforce, because of course they would be needing people, and they had these in order to create a more potential workforce, they needed to bring about certain social services measures in the country. So there were certain reformers like Raja Ram Mohan Roy, Jyotirao Phule. They all advocated for certain issues like child rights, women empowerment, education, trying to influence the early social policies and trying to break certain social evils which were persistent during the British era. The pre-independence nationalism, if you talk about the pre-independence nationalism in the early 20th centuries, various prominent leaders, particularly Mahatma Gandhi, if we talk about, they emphasized on self-reliance and social reform, focusing on sanitation, rural development, rural growth, and untouchability abolition. So they particularly talked about trying to remove any kind of discriminatory practices, abolition of untouchability was much more prominent. The Indian National Congress at that time and various other small or limited voluntary institutions, they began thinking about social welfare aspects and integrating social welfare into their agendas, which laid a foundation post-independence welfare system. When we look into the post-independence welfare state after 1947, the Indian government prioritized social welfare measures in the constitutions, establishing social services as a state responsibility. The post-independence phase here now, apart from the economic aspects, uh, because during that time India was facing a lot of issues and challenges in terms of illiteracy, in terms of poverty, in terms of lack of industrial growth, or lack of modern means and tools in agricultural practices. uh, there were no there were there were limited scope for any kind of welfare measures. So the priority was given to welfare measures and social services, and it was being entrusted with the state under the constitution, that was through fundamental rights and directive principles of state policy. So 5-year plans also were introduced, which looked into the programs for the growth and welfare of people. It catered into rural development, health education, poverty alleviation program, community development program, and so on and so forth. Then economic liberalization, economic liberalization and targeted welfare approach came into existence. The 1990s liberalization shifted the country, especially if you're talking about in the context of India, toward a market economy, prompting targeted welfare schemes which would try to reduce poverty and support marginalized groups. So this economic liberalization and welfare approach, which was being targeted, had in its umbrella various programs and schemes like Manrega, Ayushman Bharat, and so many integrated rural development program which expanded healthcare, employment opportunities, and housing accessibility. Then recent efforts focuses on digitalization and direct benefit transfer, which would ensure efficient, transparent delivery of services through Aadhaar link programs, on emphasis on inclusivity, skill development, social security for informal workers also reflected in their shift towards a more responsive and equitable welfare system. At overall, we can say that India's historical or in India's journey towards the welfare measures and welfare uh, uh, and social services had been evolved through a formal structure which is being led by the community, by the various institutions efforts to develop, to manage, to implement, to control a very comprehensive welfare system or welfare state model, which continually adapted to meet the changing needs of the society and the challenges which are there. So as this state, the process of so we can say that an important role within the existence of a portfolio of social services played a very significant role also in the process of decentralization of social services on the competence of municipalities and self-governing units, or the panchayati raj units, as well as a process of formation of specialized state administration in the area of social matters, family, and services of the employment. So the delimitation of the social services, it can be searched in the system of public policies, emphasizing the accents of the human and legal dimensions, orientation on the needs and preferences of the recipients of social services. So in a way, the social services, it tries to inculcate, or it tries to imbibes the modernization, the modern outlook of services which should be provided today, drawing the attention on creating conditions of social development from the point of regional as well as local level, in understanding the needs of the inhabitants. Uh, if you look, there are certain standard of standard of living presents a broader and more complicated socioeconomic category, which can be categorized by the form of achieved level of development and satisfying of physical, material and mental needs of human being under conditions within which these needs are being satisfied. Within the international recommendations, there are certain following indicators which would be included in the standard of living. So it could be rightly said that the social services, whether in any country which has been any country which takes up social service measures, it depends largely upon the resources, the conditions of the country, the target population of the country, the needs and expectation and demands of the population. But particularly if looking into the international considerations and recommendations, there are certain indicators which becomes universal in providing social services to each and every country, whether it's a developed, underdeveloping, or uh, developed, underdeveloped, or developing nations. So it becomes important to understand that what are the important areas or the key areas of focus when you intend to provide service to the larger population. It is in the looking into the health condition of the population, that how well you could stabilize the healthcare system, healthcare measures, what legal what schemes and welfare provisions are there in the area of health which could look after the population. Then education and qualification. Education is accessibility to free education, compulsory education, not only at elementary level but primary level, higher education, skill enhancement and development, talking about the merits of various students would be who would be taking higher education as an important means of seeking gainful employment. Then the work conditions, since social welfare services are just since social welfare services are directed towards the marginalized and vulnerable population, so it also tries to regulate the working hours, the working conditions, the social economic the environment where the labor class are constantly working, giving 10 to 12 hours, or maybe 8 to 9 hours. So that environment, the labor protection laws are there. Employment in the sense whether the person is unemployed, or creating employment opportunities, creating jobs in the market, consumption and savings, inculcating saving patterns, expenditure, trying to control the expenditure, inflation and deflation, enhancing purchasing power parity. So through social services you have accessibility to economic means and pursue transportation of if you talk about transport, it is just about the building of roads, constructing roads, or highways, or subways, but it is also connectivity of particularly of rural areas to other important areas of communications and communications, such as banks, schools, healthcare facilities, hospitals, etc. So transportation, strengthening the connectivity between remote areas of the country. Food, when you talk about food, it's the basic food should be provided to the individual. Food security measures are taken, food security act is there. Housing, affordable housing facilities should be given to the people of low income group, or some kind of rebate, some kind of subsidies, so that people could afford houses and they would have a shelter. Clothing also, when you talk about the extreme people who are extreme, there is a charitable philanthropic work which could be taken up by voluntary institutions, and during extreme weather conditions, so the distribution of clothes or distribution of blankets, which also is a part of a social service measures. Recreational and pastime, and looking into the area of human rights. When The mission and relevance of social services in modern society is of utmost importance. The changes in the whole society and transformation of society in its individual dimensions after the it's contributed to the outset and expansion, but also talked about the continuation of various or initiation, or I would say emergence of various social issues and problems and challenges, like poverty, social inclusion, unemployment, drug addiction, and child abuse, violence against women, so on and so forth. So then in the 90s, there existed a tendencies or endeavors for desocialization of social services, that is creation of alternative possibilities against traditionally used practice in most cases of applied institutional care, as well as in the extensive activity of non-public providers within the social policy of the state. So apart from the institutional mechanisms which was there in when social services came into existence through social welfare administration, through social welfare services, or the welfare state, which provide certain protection and safeguards to the population, there had also been an extensive activity of the non-public providers, that is the NGOs, institutions, voluntary institutions, philanthropic institutions. Somehow, if I say into the broader aspect of, or rather trying to bring about, the key objectives or goals of social services, is of course trying to promote social and economic equality. Social services seek to reduce disparities by providing support to marginalized communities like scheduled caste, scheduled tribe, weaker sections. It ensures accessibility to education, healthcare, employment opportunities, and aims at creating a level for all the citizens, a basic, a proper ground for accessibility and from freedom and for choice, and to exercise their freedom and choices. It ensures basic human needs and human dignity. The primary mission of social services is to meet the basic needs of individuals and communities, such as food, shelter, clothing, and ensuring that the all citizens are living a life with dignity, and their feelings, emotions, their opinions and sentiments are not hurt, neither they are being violated of any rights. Empowering individuals and communities through skill development programs, educational upliftment, employment generation programs, creation of new jobs. Social services focuses on empowering individuals to become self-sufficient, self-reliant, and actively participate in the economy, enhancing their overall productivity and social mobility. It also tries to, since it looks into the protection and support of the vulnerable populations. Social services are dedicated to the protection of vulnerable groups, including children, women, elderly individuals, and people with disabilities. They provide a safety net against exploitation, neglect, and abuse, and offer support in times of any crisis. It also promotes health and well-being. Social services would include healthcare services initiatives that would ensure individuals and communities to have accessibility to healthcare services, reducing morbidity and mortality rates, and promoting health, public health. And also it talks about the awareness and implementation of various health policies and health schemes and welfare schemes, looking into the health activity, looking into the health forum. It encourages social cohesion and unity by addressing inequalities and creating inclusive programs. Social services help foster a sense of unity, it tries to reduce social tensions, and enhance cohesion among diverse groups. The relevance of social services in modern India or in modern times would be again addressing poverty and inequality, with a significant portion of the population still living in with a significant portion of the population living below the poverty line. Social services plays a very crucial role in poverty alleviation, and like there had been a lot of initiatives which has been taken up by the government to ensure that people are above poverty line. There are anti-poverty strategies which I had been discussing in my previous lectures also. You can take note from that previous lectures that what are the anti-poverty strategies. But somehow public distributions are there, Manrega is there, Pradhan Mantri Awas Yojana, which provides basic necessities and financial support to the people who are grappling with poverty and inequality. Then supporting rapid urbanization. Of course, as India urbanizes rapidly, social services helps meet the demands of the urban populations by ensuring access to affordable housing, clean drinking water, sanitation, and healthcare in both urban as well as in the rural areas. It also talks about facilitating digital inclusion and accessibility. Social services today increasingly using digital platforms to improve efficiency, accessibility, and transparencies. Programs like direct benefit tax, direct benefit transfer ensures that the benefit is reaching directly to the beneficiary. Whoever the intended recipients are, they are directly benefited from the schemes, trying to reduce corruption and improving accountability and transparency. Then responding to health and environmental challenges, social services addresses modern challenges like public health crisis. If we have recently witnessed one public health crisis, that was the COVID-19 pandemic, and how there was service delivery mechanism was being, it was changed, or it was catering to the needs by reducing the workload, or rather it was focusing on subsidized rates, or I mean it was during this COVID-19, it was very much evident that how social services could be provided in a more smooth manner. Then it also focused into climate change and environmental degradation, which through initiatives in healthcare, disaster management, and sustainable development, ensuring resilience against any global threats. Social security, ensuring social security in the informal economy. With a large number of informal workforce, social services provide essential social security, including healthcare, pension, and labor rights. Extending the safety net to a workforce often excluded from formal benefits. And then advancing gender equality and women empowerment, social services also plays a very significant role in promoting gender equality by supporting women in women's health, education, economic empowerment, and safety through various programs and schemes. There are certain issues, in fact, when you talk about the relevance and mission and what are the key objectives, or how social services would be addressing the possibilities of providing a safety net or any kind of assistance and support to the most endangered groups of population. Considering social services as a specialized activity, or as a case maybe as of complex of as a complex of activities which would focus on prevention against appearance of unfavorable social situations of the natural process, family or community, connected with searching of solutions of unfavorable social in situations, or as the case may be, in its mitigation. Secondly, searching for solutions of crisis social situation of an individual being at a and a natural person. Then process of securing of necessary conditions, focusing for which would focus on the satisfaction of bare necessities of life of a natural person. Capability of preservation, restoration, or development of capabilities of a natural person to lead an independent life, as well as the support of its social its inclusion. Prevention against formation of social exclusion of an individual being and a natural person. And the social services, it is an integral part of the segment of social assistance, which is manifested within its external shape, in the form of specialized activities, and in the form of specialized activities on the process of support for creating conditions which would be much more effective and applicable to the larger population. Okay, I will stop here today and I will continue my lecture in the next class. Thank you.